My association with her is for a long time, right from her MBBS days when she joined MBBS in 1991. So I have seen her as an MBBS student, and then subsequently she went abroad for training in infectious disease. Then I was very happy to note that she came back and joined Apollo Hospital, Hyderabad. Dr. Suneetha and her team, they are always available whenever we have a difficult case requiring her expertise. And she goes into in-depth of all the patients, and she makes sure that the patients, we come to the right diagnosis regarding any infection, and then the appropriate treatment is started. We chat on various aspects. She's also a fitness freak, and she has taken part in 10Ks and marathons before. So all in all, she is a great clinician and also a great person, and she's an asset to Apollo Hospital. I wish her all the best, and I hope that she continues to give her services for our patients and the hospital for many, many more years. Thank you.
Dr. SUNEETHA Narreddy is a wonderful clinician and an excellent human being. I have had many interactions with her with respect to our patients having different infections, and every time I found her to be excellent, giving wonderful care and compassion to the patient's needs. Whatever may be the infection, we have answer in Dr. Suneetha. So I wish her all the very best in all the endeavors that she takes up.
I knew Dr. SUNEETHA Narreddy, I call her Suneetha, for about 3.5 years. A very lovely, pleasing lady she is. She's a very good friend of mine, and if you ask me who would you choose amongst your colleagues as friends, I would not hesitate to say she's one of my best friends, and I really wish her and her family all the best things in life. Thank you.
It's a pleasure to talk about Dr. Suneetha. I remember her walking into our department in 2008 and asking us how it will be to work in this institute. This basically shows how approachable she is and her friendly nature. Over the years, we have grown close, and it is more or less daily she calls us up, or if we have a problem, we really look up to her to interact and solve the problem. She is a very nice, down-to-earth, a distinguished individual who has been a great contribution to our institute. I wish her all the best in her career.
It's a pleasure to talk about her. She's outspoken, down to earth, and ready to explain things which people ask. Above all, if I would like to adopt one quality from her, it's the courage in terms of talking to people or explaining the concern to others. So I wish all the success in her endeavors. Thank you.
We have very few ID consultants in our country. We are fortunate to have a good ID consultant in our hospital, that is Dr. Suneetha Narreddy. She is an important member in Infection Control Committee. Her advice in managing multi-drug resistant infections, many nosocomial infections, is very important, and she gives immense support to all critical care units. She is very approachable. Whenever we call, even when she is out of the country, she responds very quickly. She is an excellent teacher, good speaker. Without including her talk, we cannot complete any critical care conference. She is an excellent human being too. She goes out of the way in helping patients. Thank you, madam. Thank you for your support, and all the best for you.
I know Dr. Suneetha, actually, though she's my cousin, I think since the 4 years that I've joined Apollo, my association with her has increased, and I've really got to know her as a person. That she's an excellent doctor goes without saying, but I don't think many people know what a strong person she is, and if you ever need any kind of help and you go to her, she'll go out of her way to make sure that, things are done for you. Akka, I don't think I can ever tell you this if I see you face to face, but I have a lot of regard for you for the immense amount of strength that you have and the way you handle your personal and your professional life. And I think you truly are a rock star in every sense of the word.
Dr. Sunitha Narreddy is one of a recognized infectious disease specialist in our India. She has dedicated her life for treating, diagnosing rare infectious disease in many patients. She is very approachable in many cases, and if I have any doubts regarding the antibiotic stewardship, she is very approachable, very dedicated to her profession. And she has any doubts, she will write to her seniors and seeks advice from them. All the best, ma'am, for your future endeavors. I wish you a long, healthy, happy life.
Your entry into Apollo came as a breath of fresh air because we didn't have a department of infectious disease then. And over the past few years, you have endeared yourself to all the consultants and your patients as a very hardworking and knowledgeable doctor. And proud to be your uncle.
She gives so much of confidence for us, especially in our transplant team really. Whenever there is a problem, infectious diseases problem, we just always fall back to her because she gives so much of reassurance. She's always very, very methodical, gives a lot of structure to whatever the assessment she does, which gives a lot of confidence really for us, particularly for all these complex transplant patients. Gives a lot of reassurance, and not just that, she is just a very nice person at heart, and she gives a lot of reassurance and confidence, not just in the professional aspect for in terms of not just the patients, but also in terms of being working with her really. So Apollo has definitely been blessed having her in the hospital, but we are also so pleased and reassured to have her as a part of the transplant team really, that we continue to work together, and I wish her all the luck for her future adventures, and thank you very much.
What do we all do when we're in trouble? We call for the cops. For a patient with kidney disease, trouble means infection. And the best and the most honest cop that we have here to take care of infections is Dr. Sunitha Narreddy. And many a time she's helped us out when we had patients who were complicated by infection. She brings a very refreshing and a wonderful approach to treating patients with infections, and all the time it's a very rational way that she looks at things. Initially, when she formed the unit of infectious diseases in our hospital, we were a little skeptical because we thought at that point in time that infection is the domain of internal medicine. But after seeing her approach and after seeing the value addition that she gave to infections, we realized that yes, this was someone who could really help us out when we had complicated problems. In fact, I owe it a lot to Dr. Sunitha to remove my misconceptions on PDRs and MDRs, ESBLs and AMC beta lactamase. She is a person who is extremely friendly. She has got wonderful communication skills, and she's very good at the bedside. Her clinical skills are also marvelous. What I admire the most about Sunitha is her ability to balance her work and her life. She has got two very well brought up children, and it's very obvious the hand that is behind this upbringing. As far as work is concerned, she is extremely committed. She was always around whenever required, and she communicates with the patient so well that after her talk with the patient or with the family goes away feeling that they have encountered the best friend that they have ever had. So here's wishing Dr. Sunitha all the very best, and may she take infectious diseases to greater and greater heights.
Sunitha మాకు ఒకే అమ్మాయి అయినా కంబైన్ ఫ్యామిలీలో పెరిగింది. అందువలన ఆ పాపకు కానీ మాకు కానీ ఒకే అమ్మాయి అన్న ఫీలింగ్ ఎప్పుడు లేదు. చిన్నప్పుడు ఆ పాపకు బాగలేనప్పుడు ఎప్పుడైనా నేను డాక్టర్స్ దగ్గరికి తీసుకెళ్తే అక్కడ చాలా వెయిట్ చేయాల్సి వచ్చేది. ఆ టైంలో నేను అనుకునేదాన్ని ఈ పాపని డాక్టర్ గా చేస్తే బాగుంటుంది అని. దేవుని దయ వల్ల ఆ పాప హార్డ్ వర్క్, సిన్సియారిటీ వల్ల ఆ పాప డాక్టర్ కాగలిగింది. చిన్నప్పటి నుంచి చాలా పద్ధతిగానే పెరిగింది. చాలా పొదుపుగా కూడా ఉండేది ఖర్చుల విషయంలో. తను చదివిన ప్రతి చోట మంచి పేరు తెచ్చుకుంది.